let's talk a minute about what the signs are for hypertrophic cardiomyopathy. Hello, I'm Marty Maron. I am the director for the Hypertrophic Cardiomyopathy Center at Lahey Clinic. Hypertrophic cardiomyopathy, or HCM, is the most common genetic heart disease that we have in the entire world, where patients are usually born with a mutation that causes an increase in thickness to the heart muscle that usually develops that thickness early in life, like puberty, early adulthood. The symptoms that patients can sometimes develop from HCM can develop or begin almost really at any point in time in one's life, but typically begins to occur most commonly in midlife, 30s, 40s. That's the average. And the most common, of those by far and away is the development of shortness of breath. That typically occurs with exertion rather than at rest. And it most commonly occurs with the type of exertion where patients are, usually engaged in what we call inclines, like stairs or hills, for example. Well, they will notice being more out of breath than they think they should be for that level of activity. But other signs and symptoms of HCM, in addition to the shortness of breath, include sometimes chest pain or pressure, palpitations, which just refers to your heart racing, or a feeling of your heart racing, lightheadedness, dizziness. Those symptoms should be investigated, meaning you should raise them with your doctor so that the appropriate testing can be done to ensure that the patient either doesn't have any heart issues or a other cause for those symptoms could be discovered. Those symptoms can often overlap with symptoms from other heart diseases or other non-heart disease situations, lung disease, etc., for example. And so if you have those symptoms and you don't get an explanation for why you may be having them from your physician, you really need to keep moving till you get an explanation and that a clear answer for those symptoms has been identified, because there can be many different potential causes to those types of symptoms, including, of course, HCM, but investigating that until we're sure that heart disease is not responsible for them is really, really important for patients.